Hello and welcome to a bumper 90-minute edition of Trevor Phillips on Sunday. It's beginning to look a lot like Christmas. Christmas 2020, that is, when we couldn't get together with our colleagues at work or friends and family at home. But not everything's the same. The good tidings are that this year most of the population's vaccinated and more than 20 million of us are boosted. Hallelujah! But before you rejoice, hark to the choir of government's scientists and the BMA. They want yet more restrictions, including a ban on indoor mixing. You might need a smaller turkey. As for the Prime Minister, in the past week, he lost half his backbenchers in a crucial parliamentary vote, more than half his electorate in a by-election, and last night, Lord Frost, the minister who was supposed to deliver the final Brexit deal. Lord Frost didn't get the memo about when Lords are supposed to be leaping. That's after Christmas, mate. We'll try to unwrap all that with our guests this morning. In a moment, I'll speak to the man with the huge responsibility of leading the government's management of COVID and the health service, Health Secretary Sajid Javid. And we'll be joined by his opposite number in Labour, Shadow Health Secretary Wes Streeting. We'll try to make sense of the latest phase of the COVID crisis with former Chief Scientific Advisor to the UK government, Sir Mark Walport, and dive deeper into the data with statistician and Cambridge professor David Spiegelhalter. Meanwhile, it's been another extraordinary political week. We'll speak to Liberal Democrat leader Ed Davey following the party's stunning victory in the North Shropshire by-election. And that, of course, piled yet more pressure on Prime Minister Boris Johnson, which has only increased with the shock resignation of his key Brexit lieutenant, Lord Frost, yesterday. So we'll hear from leading Brexiteer Tory backbencher Peter Bone. The hospitality industry's leading called for more support from the Chancellor as pubs and restaurants suffer from cancellations and plunging sales in a crucial trading period. So we'll speak to the world-renowned chef and restaurateur Michel Roux. Given all that, it might be easy to forget it's just a few days to Christmas. I'll speak to the Bishop of Dover, Rose Hudson-Wilkin. But let's start. I'm joined by Health Secretary Sajid Javid. Good morning, Health Secretary.
Good morning.
What do we know this morning about the spread of Omicron, infections and, crucially, hospitalisations?
Well, ever since we've learnt about this variant, our strategy has been clear to buy time to assess it and time to build our defences. We're learning more about Omicron all the time, but the truth is we still don't know enough. And there's gaps in the data that we have. There are significant uncertainties as we look ahead, but we must work with the data that we've got and not let the perfect be the enemy of the good. So let me just share with you very quickly what we do know. First of all, we know that Omicron spreads very, very quickly. We can all see the rising case numbers, but we know that there are many more people behind those case numbers that are infected because not everyone is taking a test, or there's always a delay in getting test results. And so the actual number of infections would be significantly higher than what case numbers suggest. And we know that case numbers and infections are doubling at around every 2 to 3 days. And that's observed data here in the UK, from South Africa, from Netherlands, Denmark. That's observed data of Omicron. The second thing we do know is around vaccines. So we know that 2 vaccines are sadly not enough to protect you against symptomatic disease, but 3 vaccines are. 3 vaccines are excellent in the protection they provide. That's why we've focused very heavily on our booster programme in the last few weeks. I'm pleased to say in the last week in England, we've seen 4 million boosts, over 4 million boosts. We've seen new records being hit every day. And I'm told that yesterday was a new record day as well. And so that is a very high level of protection we can build on. But the third thing that we don't know enough about, and this is important, Trevor, is that so we know about the spread, we know about the vaccines, but we don't know enough about the severity of Omicron. And so there is data from South Africa when you look at their hospitalisation rate versus Delta that definitely suggests they got a lower hospitalisation rate. But we don't know whether if that means the virus itself is intrinsically less severe, or does it mean that South Africans have more protection through natural infection or vaccines or in other ways. So, and just a final point, because if I may, is that with the severity, that even if it turns out to be less severe, and therefore a smaller percentage of people are hospitalised here in the UK than with Delta, a small percentage of a large number of infections could still mean a significant number of hospitalisations. OK,
that's a good, complete, comprehensive picture. Just one small detail. The reported number of infections running something like 90,000, maybe 100,000 a day, but you've just said that you think actually that probably means that the actual level of infections is much higher. We're being told that, for example, it could be as high as 300,000. What is the multiple to which you're working right now? If the official figure that we're seeing is 90,000, what do you really think it is?
Well, so let's to be clear about this. You said reported number of infections about 90,000. Not infections, that's case numbers. And the difference between a case and an infection is cases are a subset of infections. That's where someone was feeling unwell, they've got a test, and it's been confirmed. So the 90,000, by the way, isn't just Omicron. That is Delta, still predominantly Delta, and with about a significant degree of that being Omicron. But infections, what we already know, perhaps I can better explain with Delta, because we've got much more data on that. Typically, the case numbers represent around a fifth or a quarter of total infections at any one time. And so with Omicron, we know that the infections the cases that we're getting, the confirmed cases, it will be a subset of total infections. But because of the speed at which it's growing, doubling every 2 to 3 days, it's likely to be an even smaller proportion, the cases, of total infections. So it's hard to say with any kind of certainty what's the total number of infections, but we know from all this data that they are growing significantly in the community. So, for example, we know from a test called S-gene target failure, which is basically a proxy test for Omicron. It's a lot quicker doing that than the sequencing. We know that it's currently running at around 60% of all cases, all new cases in England overall.
OK, so in fact, we could be seeing a level of Omicron infection which is more than 5 times the numbers case numbers that we're seeing reported. Let me ask you about another specific issue. What do we know about the proportion of people who remain unvaccinated?
Well, we know, first of all, in terms of numbers, about 88% of the population over the age of 12 have taken at least one vaccine, and 80% have taken 2. Over half the people of adults are now boosted. So that's really good in terms of great set of numbers, especially the boosters, the biggest booster program in Europe. There's about, let's say, around 10% of the population that remain unvaccinated. And we know in hospital, when you look at hospitalizations, they make up a disproportionate amount of those that are severely ill. In fact, if we look at those that are the most ill in hospital, needing the most care and attention, around 9 out of 10 of them are unvaccinated. And if I can say, Trevor, because it's a really important issue, that people have had over a year, almost a year now, to get vaccinated. There's still 10% of our population that have chosen, for whatever reason, not to get vaccinated.
We're talking about 5 million adults plus.
Yeah, 5 million plus. And I just cannot emphasise enough the impact that they are having on the rest of society. They must really think about the damage they are doing to society by they take up hospital beds that could have been used for someone with maybe a heart problem or maybe someone who's waiting for their elective surgery. But instead of protecting themselves and protecting their community, they choose not to get vaccinated. They are really having a damaging impact. And I just can't stress enough, please do come forward and get vaccinated. It's a really positive thing to do, not just for yourself, for your loved ones, but for your community too.
I've dwelt at some length on the numbers because this is at the heart of the dispute that's brewing amongst your parliamentary colleagues. You suggested, for example, at the beginning of this week that we could be up to 200,000 cases a day.
Infections
a day. The trends don't necessarily, as we understand the data, suggest that that's quite where we are. some of your colleagues think that you're overstating the data in order to allow you to bring in more restrictions on the population.
Well, in fact, the data we use is the data as it's being observed. So we know case numbers. We understand a lot more about COVID and infections over the last couple of years. A lot of data has been built up. Globally, through scientists around the world, they understand a lot more about that. It is true, however, that you can't be certain about everything, especially with a new variant. We can see already in the community how quickly this is growing. But when analysis is done, so for example, the SAGE committee of scientists that advise government have just published what they view as their latest assessment of the situation. That they've given an analysis, and as ministers, of course, we will look at that analysis, but we can't just sort of simply accept it as that is the fact and that is definitely what's going to happen. As ministers, we do have to challenge it. We have to look at some of the underlying assumptions and challenge on those. And also, as ministers, when we make decisions on the data that we are presented with, of course, we have to think broader than just the epidemiological situation. And have to think about any action that we take, the impact that it might have on people's life chances, on businesses, on children. So ministers' jobs is to take a much broader view.
But before we get to that, what your critics would say is that you get properly presented with a range of scenarios by your scientific advisors. And what I think many would be saying is that you choose the scenario to which you are responding. And invariably, that's turning out to be the most pessimistic. So, for example, you yourself have just said that the emerging evidence from South Africa is that Omicron might be less severe than we might be. Yeah. But you've chosen to act as though it is at least as severe as Delta, so that you are actually choosing the evidence to which you're responding, rather than looking at the range of evidence you're being offered by scientists.
No, Trevor, if I may, I don't think that's the case at all. And let me explain. Is that it would be wrong, absolutely wrong for government to say, look, we think this is as severe and that's how we're going to behave, because we don't know. There's a lot of uncertainty around Omicron, and we have to accept that. There are gaps in the data, as I've said. But we have to use the data that we've got. The data that we do have is around how fast it is growing and about the vaccines.
Health Secretary, is the data you asked for. Graham Medley...
Well,
let me just put this to you. Okay. The Graham Medley, who's the chairman of the SAGE Modelling Committee, told The Spectator yesterday, we generally model what we are asked to model. There is a dialogue in which policy teams discuss with the modellers what they need to inform their policy. What is that supposed to mean if it doesn't mean that they're giving you the evidence that you want?
I think what it means is that they, as in this case, I think he must be referring to SAGE, which are the government's sort of scientific advisors, is that what they are modelling is the question they would have been asked, broadly put, is taking into account all the data you have both from the UK and abroad on this new variant, where do you think it's heading? I think that's the broad question. And they inevitably, and perfectly understandably, would come up with a number of assumptions that they would make. But as I've said, our job as ministers then is to obviously to look at that report. It is very sobering when you look at it, but to look at it and then to challenge, to sensibly challenge underlying assumptions.
But if the report only tells you what you want to hear, there's not much challenge involved there, is there?
Well, it's not.
He's saying that we tell the government the things that it's asking us for. We're not telling them other things that we might know that they're not asking.
Well, asking in the sense, I think what he means is that asking in the sense that the government's request is tell us what you think the data suggests about where this thing is heading. It is, if it was something that I was asking for, of course, what I'd be asking, who would want to ask for an outcome like the one that they're suddenly currently presenting? My job is to challenge that, and that is what the government is doing, and I think it's the appropriate thing to do. There are some people, can I say, Trevor, there's some people out there that think that lockdown is the answer to any new challenge we face. There are others that think that you shouldn't do anything at all. And my job, the government's job, is actually to look at the data, to make the best assessment we possibly can and act on that.
All right, let's come to what you actually have to do. You are almost certainly going to have to ask people to undertake or endure new restrictions. And it's being reported that there is a plan, or there are plans being drawn up for a circuit breaker lockdown after Christmas. I'm not asking you whether you've decided on that or not, though you can tell me, but is it true that those plans are being drawn up?
Look, we've taken measures already. I took the Plan B measures through Parliament this week, which I didn't enjoy doing one bit at all. I didn't come into government to restrict freedoms of people, but I think people understand why we are presented that action to Parliament, and we keep the situation under review. Of course, we will assess the recent report we've been given by Sage. We will challenge certain assumptions, and we'll come to a government decision. But can I say we are entering this phase of this pandemic in a very strong position, and the reason for that strong position is because we opened up in the summer. We have the best vaccination program in Europe, especially our booster program. We have new treatments that didn't exist before, including antivirals. And we have a fantastic testing regime.
I'm not interrupting you for the sake of it, but we've had this conversation before, and viewers have heard that. Just to be clear, in your last answer, are you telling me that you've actually had a suggestion from Sage that there should be further lockdown?
No, the suggestion we've had from Sage is the one that they've published. It's in their minute. It's public. So their suggestions, I think, are quite clear there. But as I say, as government, we are advised by scientists, but it's ultimately that ministers will make a decision. And when we make a decision, there's a number of factors that we need to take into account.
If, as we are hearing from scientists and from the BMA, that the numbers are suggesting that there should be further lockdown, will the government be prepared to undertake that?
We've shown in the past, as government, in dealing with this pandemic, that we will do what is necessary, but it's got to be backed up by the data. And as I say, we are in a very...
If the data suggests that unless you act now, as some scientists are saying, and you've already said the doubling numbers are dramatic, every day counts, if the numbers suggest that we should have further restrictions, will you be ready to do that?
We are watching the data, discussing it with our scientists and our best advisors almost on an hourly basis. And we will monitor that very carefully. We will keep the situation under review. But I can't stress enough how the situation today in terms of our defences is very different. You started your programme today by comparing it to Christmas last year. One big difference to Christmas last year are the vaccinations, the antivirals, the other treatments, our testing systems, and the fact that we opened up in the summer in the way that we did.
And if you did have to take some new measures, would you recall Parliament to approve those measures?
Look, if, and it's an if, the Prime Minister's already been clear to parliamentarians, if there was a need to take any further action, we would recall Parliament, and it would have to be a decision for Parliament. That is only right and proper.
Let's talk about the politics. Lord Frost went last night. Did you know that was going to happen, and do you understand his reasons for leaving?
I didn't know it was going to happen, and I do understand his reasons. And let me just say this first about Lord Frost. I've had the privilege of working with him now for a couple of years. I think he's an outstanding public servant, and I think that the way Brexit was done and how we achieved that and achieved those successes, he's been a central architect of that. So I wish him the best, but I do understand his reasons. He's a principled man. Principled people do resign from the government. I know all about that, and that's something that's a decision for him to take.
But it's pretty catastrophic, isn't it? Half your backbenchers voted against you during the week. You lost in North Shropshire. What is undeniable is that the magic of Boris Johnson has gone. Last time we spoke about this, I asked you, and I in fact asked Mr Zahawi last week, whether Boris Johnson was still the election winner. When we spoke, you said one word, yes. Are you still prepared to say yes?
No, I think Boris Johnson...
No, just the one word.
I think Boris Johnson is the best person to take us through the challenges
the country faces. That's not the same thing as saying he's an election winner.
Yeah, we've had one very disappointing election result, and from that, you cannot take away the ability of Boris Johnson to win election after election. Remember, just a couple of weeks ago, we had a by-election victory as well. So this, don't get me wrong, I think the North Shropshire result was a very disappointing result. We have to learn lessons from it. We especially have to listen to the people of North Shropshire, and I hope that at the next election we can win that seat back. But when you're asking me about Boris Johnson, remember, it is Boris Johnson that made the decisions around the pandemic to keep Britain out of the European Medical Agency, for example, which meant that we had the biggest and the best vaccination programme in Europe, to buy antivirals, to open up in the summer. It's the same Boris Johnson that is taking us through this pandemic. OK,
well, here's what the people of North Shropshire said to that same Boris Johnson with their vote, which is, after Barnard Castle, after the Christmas parties, after pretty much everything else we're hearing out of Whitehall, same question I asked your colleagues more than once this year. Why should we, when we obey the rules and you flout them, why should we pay the blindest bit of attention to what you tell us to do, Mr. Health Secretary, when you say we need to tackle Omicron?
You know, I understand that. And I absolutely understand where those kinds of questions might come from. And that is why I think it is really, really important that we maintain public confidence by having that investigation that is now taking place. Sue Gray is carrying out this investigation, and that will establish the facts.
You put it in the hands of somebody that you pay and who owes her job to you. Shouldn't it be led by somebody independent?
Well, I think that's not... Yeah, I know this isn't your intention, but I don't think that's very respectful to Sue Gray.
No.
She is
I'm not being disrespectful to her.
She's a senior civil servant. That is someone who is known for her neutrality and her probity, and I think that Javid, having a senior civil servant that is not a minister, not a politician, carry out an investigation, that's not unusual.
Mr.
First
Javid,
of all, I think
that's exactly the sort of Whitehall answer that makes people feel cynical. That of course you would say that, but actually the question is, shouldn't somebody independent do this? And let me just ask you, because we're running out of time, let me just ask you what this is really about. In Scotland, they've already moved to tougher measures. And they're doing that with confidence because people believe in that country, in their Prime Minister. Can you look me in the face and say honestly that you believe that England will be equally compliant when asked to do tougher things by a Prime Minister who can't even impose discipline on his own office?
I think people will. First of all, you're suggesting there are new measures to take, and let's just see what happens. And we keep, as I say, we keep the situation under review. But if we do have to take further measures as the situation develops, if we have to do that, then I believe the British people will respond in the same way they have throughout this pandemic, whereas they understand the issues, they know just how important it is for them and their families, and they will respond accordingly.
Health Secretary, thank you very much for your time this morning.
Thank you.
The man tasked with shadowing the Health Secretary for Labour is the recently appointed Wes Streeting. So far, he's supported additional COVID restrictions and the party's helped the government get them through Parliament, despite rebelling Tory backbenchers. Now, with talk of more restrictions and more rebellions, the government might need that support again. So how far will Labour go? Wes Streeting joins me now. Good morning, Mr. Streeting.
Good morning, Trevor.
You've become Secretary of State. You've heard the Secretary of State and on their response. He doesn't seem quite yet to have decided that there are going to be more restrictions. Are they right to wait and see what the data will show?
Well, two things. Firstly, if there's one thing that the SAGE report, the minutes published yesterday, tells us, if there's one thing that our experience in the pandemic tells us, it's that action sooner rather than later means that the strength of the restrictions and the impact on people's lives, livelihoods and liberties is lowered. So action sooner rather than later would be better rather than worse. The second thing to say is, listening to Sajid Javid this morning in that interview, he looked like a hostage to his own party, and that's because he is. What we saw this week in Parliament with the huge rebellion over 100 Conservative MPs on what were actually quite modest measures tells us that the Prime Minister has a big problem when it comes to the crisis of confidence in his leadership within his own ranks. And crucially, that is impacting on the government's public health response. So Sajid Javid looks like a hostage. The good news here is that the Labour Party is here to rescue him from that situation. He doesn't have to negotiate with the people holding him to ransom on his backbenches, because we will act in the public interest. We will put public health before party politics, and we will work with government scientists, medical advisors, as we have done throughout the pandemic, to put public health first. And that should be the only focus of the government.
Well, that is immensely generous of you. But the truth is you disagree on some of the detail, but basically you support what Johnson and Javid want.
Well, we'll be guided by the scientific advice. We're hoping to meet with the Chief Medical Officer and scientific advisors today for a briefing on where we are, to test some of their assumptions and to think about what might be necessary. There are areas where we think the government can and should have gone further already, actually, which is not about restrictions. Statutory sick pay should be higher because there are lots of people who are supposed to be isolating but feel they can't afford to do so. As a result of the very sensible advice that Chris Whitty gave the country earlier this week, lots of people have voted with their feet, have made different choices about how to spend their social interactions, whether they're going out socialising. The hospitality industry and others have taken a hit through no fault of their own, and support there is needed for the industry. The government could, for example, with these COVID loans that people have taken out, give people a bit of a repayment break, help get their finances in order. So there are things the government can and should be doing which they're not. So it's not just the case that we're voting to support measures in the public interest. We are encouraging the government to go further to help people who are feeling pain in their pockets.
Yeah, but with respect, that's all the nice stuff. It's everybody's in favour of giving the public more money. Will you be in favour and will you be voting with the government if they bring in further restrictions, for example, a further lockdown?
Well, I don't think anyone wants to see a lockdown. I hope we don't have to go.
But if the data tells you that that's
lockdown.
what's needed, as scientists are beginning to say this morning, will you be ready to vote for a further lockdown?
But as I say, Trevor, I don't think that a lockdown would be necessary if the government takes action sooner rather than later. So, I'm not trying to be difficult about this. We're going to see the Chief Medical Officer and the scientific advisor.
But when you say
we'll follow the advice.
Well, when you say sooner rather than later, the scientists are saying today, this morning, get on with it. And I don't quite understand what you're saying. What are you waiting for? To say, let's get on with it. Either you believe the scientists or you don't.
Well, with respect, the government had this advice on Thursday in the form of the SAGE minutes. The government have access to far more information, options, advice than the opposition do. I don't think unreasonably, given that I saw the SAGE minutes last night, that I want to speak to the Chief Medical Officer and scientific advisors so that we can come to an informed view, and I hope that will be today. The question is...
so we might hear something from...
The question is... Well, I think...
we might hear something from Labour tomorrow.
The question is, why is it, having received that advice on Thursday, the Prime Minister has said nothing, done nothing? Well, I can tell you why. It's because he's hiding from his own backbenchers instead of leading. And that kind of weakness in place of leadership should really concern the public, because I think people out there know that measures are necessary. All they want to know is what measures, when, and how can I plan for them. Contrast that with what's going on in Wales. Mark Drakeford, the First Minister, set out a plan that takes Wales right into the new year. I dare say people won't necessarily like measures. Who does? But at least people have some certainty. They know he's doing the right thing for the right reasons, and they can see what that path looks like. Why don't we have a plan for England?
You've told me you're meeting the Chief Medical Officer?
We hope so. We're due to have a Cabinet Office briefing.
So let's say 48 hours. So we can expect within 48 hours for Labour to take a view about whether we need further restrictive measures or not.
I hope so. I mean, if the Prime Minister isn't prepared to lead, we've shown that we are prepared to lead, and we're prepared to do what is necessary in the public interest. We put public health before party politics early this week. We will continue to do so again. I think it would be preferable, by the way, for the government to have a plan and for them to pick up the phone and work with us in the national interest. We're prepared to do that too. But the question is, how is it, having known this information on Thursday, that the government have failed to say anything, do anything. In fact, the only thing, beyond the interview we heard from the Health Secretary this morning, his other big intervention is an op-ed in the Daily Telegraph today. Why? Okay. Because he's talking to his party, not talking to the country. He's negotiating with his backbenchers. He's not working in a bipartisan way to take the action that might be necessary to get the country through this. And that's what I think we should be concerned about. The Prime Minister's weakness is now undermining public health.
Well, let me ask you a question about something that might be puzzling some viewers. If you think that the Prime Minister's essentially the biggest obstacle here, why are you voting consistently to support his measures and essentially keep him in office? Wouldn't it be the best thing for a responsible, patriotic opposition that thinks that Boris Johnson is not fit to lead, quote your leader, who is the wrong person to be guiding us through this crisis? Wouldn't be the most important thing, number one priority, get rid of Boris Johnson?
If there's a motion of no confidence tomorrow, we'd be voting for that. Why
didn't you put it up?
Because, Trevor, you know as well as I do, had Labour played party politics in the way that you described with the votes earlier this week, the measures would have fallen, public health would have been weakened, and people would have rightly said, why is Labour playing party politics with public health? You also know, if we tabled a motion of no confidence in the House of Commons tomorrow, the Conservative Party MPs, including those who think Boris Johnson is a busted flush and an albatross around the necks, they'd vote against the motion because they'd pull together. So look, there are lots of armchair critics who say, why don't Labour do this? Why don't Labour do that? The answer is because we thought it through and we've realised that these are futile measures. We're not going to play party politics with public health. And what we are going to do is show the leadership and responsible leadership that the country would expect to see from us. And that's what we've done this week.
Do you think if the government seeks further restrictions, do you think the public is going to fall in line again?
Well, I think the press conference earlier this week with Chris Whitty showed us that while people have lost trust and confidence in Boris Johnson, they do trust, as we do, the Chief Medical Officer, they do trust the Chief Scientific Advisor, they do trust the NHS. So in the end, I trust the British people to do the right thing. I think what's reprehensible here is that Boris Johnson, through his own actions and the actions of those people around him, have undermined trust and confidence in public health messaging from the government at a critical time. And that's why I think, to be honest, when it comes to the next phase, Boris Johnson, if he's determined to stick around like a bad smell, needs to take a step back and push to the forefront of public health messaging, clinicians, people on the front line of the NHS, because people do trust them and they do trust their experience. And so I think in the end, the public will do the right thing. We're a law-abiding country. But at the moment, people are making their own decisions because the government isn't leading. All
right, this is a politics show. Let's talk politics. And let's talk about the by-election this week. To give him his credit, Boris Johnson took responsibility for the Tories' loss in North Shropshire. When is your leader going to take responsibility for losing nearly 9,000 votes in this by-election? Last time round, you had more than 12,000. This time, you didn't break 4,000.
I don't think we're disappointed by the result in North Shropshire.
What, you lost 3/4 of your vote and you're not disappointed?
I think it's a significant defeat for Boris Johnson. And what North Shropshire shows us, Trevor...
Steady. You were second in this seat. The Lib Dems walked straight past you. Come on.
I think what North Shropshire shows us, Trevor, is that political parties are perfectly capable of making informed judgments about where to spend their resources, and voters can be trusted to make the decisions that give them the outcome that they want. In this case, removing a Conservative MP. And I'm not the slightest bit disappointed by the result in North Shropshire.
OK, you're obviously having a laugh here, but there is a serious point here. Doesn't this demonstrate that if you are absolutely as serious as you purport to be about Boris Johnson's failings, that the Labour Party, the Liberal Democrats, the Greens, all now have to start thinking, if they really mean what they say, that it's time to start thinking about an alliance that would actually put you in power, because that's the only way to get rid of this person that you never cease to say, day in, day out, is not fit to lead this country.
I don't think that voters like the idea of backroom deals and pacts between political parties. I think voters are perfectly capable of making their own informed choices about the outcome that they want to see. So, looking at the lie of the electoral map, there will be some parts of the country where getting rid of a Conservative MP, the route to that, the best route to that, the easiest route to that is to vote Liberal Democrat. There are far more places in the country where the route to getting rid of a Conservative MP and delivering a Labour government is by voting Labour, and voters can make those informed decisions. No, I don't think that's the choice, actually. If Boris Johnson leads the Conservative Party into the next general election, more for the Conservative Party, but that's for them to worry about. I think what the Labour Party has shown this week in particular, but since Keir Starmer became leader, is we've got a serious leader with a serious team capable of governing the country. We know we've got more work to do to win back trust. Don't want to give your viewers the impression we're in any way complacent about this, but we're determined to do that work. We're determined to win the trust and confidence of the people. We can do that without backroom deals, and we'll put our best foot forward and let the people decide.
Wes Streeting, thank you very much indeed. If it's been a bad week for the government, but a good week for the Liberal Democrats, it usually means there's been a by-election. Well, that was certainly the case in North Shropshire, somewhere that's been true blue for 200 years, until the Lib Dems overturned a vast majority to take the seat that used to be held by Owen Paterson. Lib Dem leader Ed Davey tweeted a video of himself celebrating with a fist pump when that result became clear. Now, he joins me again. Sorry, there you are. Ed Davey, you must be very cheerful this morning. Congratulations. Is this the start of the Lib Dem resurgence, or is it just the usual mid-term protest vote that will disappear in a general election?
Well, Trevor, I'm very excited by our victory. It's the second by-election victory for the Liberal Democrats against the Conservatives this year. That's not happened since 1993. So I'm really proud of our party. I'm really proud of our campaigners. And I think we've brought hope to the whole nation. We've proven that Conservatives can be beaten anywhere. And I think we've confirmed the reality that if we're going to get Johnson and the Tories out of office, it's going to take the Liberal Democrats beating Conservative MPs in their blue wall seats.
Well, when you say you can beat the Conservatives anywhere, let's just talk a bit about the nature of your campaign in North Shropshire. We had a look at your election leaflet. Sleaze was referenced 13 times. Christmas party scandal mentioned just once. Healthcare is what you focused on, with 140 mentions in the leaflet, including 72 mentions of the ambulance station being moved from Oswestry to Shrewsbury. Farming mentioned 41 times. Essentially, you didn't really talk to the voters of North Shropshire about Boris Johnson at all. You focused on some local issues. Are you going to do that everywhere and expect to beat the Conservatives?
We focused on the issues that the voters were concerned about. It's the Westminster bubble who thinks it's all about Partygate and Peppa Pig and so on. We knew different, and the voters of North Shropshire knew different.
You didn't raise that, you did.
No, they raised it to us. I went on the doorstep, Trevor. I went to North Shropshire 5 times. I campaigned for 10 days. And in the early days, way before Partygate, what people were saying, they were worried about delays to ambulance services. I heard really sad stories about people waiting in pain for 8, 10, 12 hours. And we responded to that. So we looked at what the Conservatives have been doing on ambulance services, and they'd failed the people of North Shropshire. The West Midlands ambulance service is in crisis, and the Conservatives have done nothing about it. They've taken the people of North Shropshire, as in so many parts of the country, totally for granted. So I make no apology for the Liberal Democrats campaigning on health issues, on farming issues. They were the issues that were really important to the people of North Shropshire. We will be a community politics campaigning party, not just in North Shropshire and Cheshire and Amersham with our amazing by-election victories this year, but across the country. There'll be many Conservative MPs now who are really worried. The Liberal Democrats now are putting on a performance in different parts of the country that is the sort of things that saw the Conservatives thrown out of government in 1997 for 13 years. So, I do have a smile on my face. I do think there's new hope for our country. And I do think the Conservatives are in real trouble.
But when you say, Ed Davey, that you can beat the Conservatives everywhere, you're now saying that you'll do that largely on the basis of what's happening locally. Doesn't that open you to the traditional criticism of Liberal Democrats that you will say one thing in one constituency and say pretty much the opposite next door if that's what suits you locally?
Well, that criticism has never been true, and it's not true now. We're campaigning on the health service in constituencies around the country. It's a national issue. And we're not campaigning on farming issues in urban areas because there are no farms, Trevor. We campaign on farming issues in farming areas where there are farmers who want to know about our policies on that. Our policies on farming are still available to others, of course. So I think this argument
but
that sometimes
you tell the farmers in North Shropshire that a Lib Dem government would spend more money on farming, and you're telling the voters in London urban constituencies that you'll spend the money on something different, won't you?
No, not at all. We always put forward a costed manifesto, which we publish for the whole country. And actually, I think my constituents are worried about what's happening to Britain's agriculture, actually, because the Tories are breaking their promises. They said they would put in place a system to support our farmers, but are actually taking that away before the new system is come in place. That's another broken promise, just like the Conservatives have broken promises on the triple lock on pensions, for example, on levelling up. And I think there's a story about the Conservatives. They are letting people down. They said all these things. Boris Johnson said all these things, and he's not delivering. They have taken people for granted. That is why the Liberal Democrats won in North Shropshire, why we won in Chesham and Amersham, and why I'm so excited about the prospects ahead of us. I think there's a real chance of getting Boris Johnson and the Conservatives out of power the next election, and I think the Liberal Democrats have shown the way.
Well, let me put the same question to you that I put to Wes Streeting. Surely the best chance of getting rid of Boris Johnson and his party from government would be if there were some cooperation between the parties who all seem to think the same thing about him and his administration. Why aren't you ready for an alliance with other parties on the centre and on the left?
Trevor, let me first say that I'm really grateful to traditional Labour voters, lifelong Labour voters, who in North Shropshire and indeed Chesham and Amersham lent Liberal Democrats their vote so we could beat the Conservatives. It worked. But the issue really is allowing voters to have those choices. These choices are organic in many ways. You don't need a formal, even an informal pact or deal. Voters can work out which is the candidate best placed to beat the Conservative MP during our first past the post system. And it shouldn't be surprising anybody that opposition party leaders want to see the Conservatives beaten, and they're going to put our resources where we think we are the best vehicle for beating the Conservatives. We will make our positive case, absolutely, but I think people from other parties who know where the Liberal Democrats are the challengers, they will come and back us. That's what happened in North Shropshire.
Ed Davey, well, it looks like you're going to have a happy Christmas. Thank you very much for your time this morning.
Thank you.
Well, let's focus on COVID again and those sharply rising cases and increasing hospitalisations, especially in London, that mean that the government is once again wrestling with the introduction of yet more restrictions on our daily lives. I can speak now to Sir Mark Walport, who was the Chief Scientific Advisor to the UK government between 2013 and 2017. He's now the Chief Executive of UK Research and Innovation. Good morning, Sir Mark.
Good morning.
Does the scientific data that you've seen suggest that we need further restrictions and further restrictions now?
Well, I mean, in a word, yes. We're at risk in a difficult moment. Infections are rising fast. We're identifying more than 90,000 cases a day now, but that will translate actually into hundreds of thousands of new cases a day. And in London, which is the worst affected at the moment, and incidentally is also, well, not incidentally, is also the least well-vaccinated part of the country, hospital admissions are rising significantly. So we need to act to hold down the rate of hospital admissions, reduce the pressure on the workforce, and of course, a lot of people are off sick at the moment, and most importantly of all, give people the chance to get vaccinated, to get boosted, and allow time for those vaccinations to have effect.
Let's unpack some of that in a moment. But before we do that, aside from the booster and vaccination, what would you say are the most effective steps, policy steps that could be taken now to slow the spread of Omicron?
The effective steps are the steps that we can all take, which have been the steps all along, which is that this is a virus that transmits by moving from one person to another, particularly through aerosol and droplet spread, so respiratory spread. And so distancing people one from another is by far and away the most effective way of stopping that spread, but also wearing close-fitted masks. And, it's clear that people's behavior is becoming more cautious, and that makes common sense. So it is about, as I say, well-fitting masks, avoiding crowded, indoor, poorly ventilated spaces, lots of people, reducing contacts, and making sure that we test a lot. So we've got tests, and we should use the results. If we have symptoms, we should isolate. These are all measures that we can take. And Plan B, is obviously heading in that direction, but the modelling projections suggest that it won't be sufficient on its own to flatten the peak and reduce the pressure on the health system and on people being off work.
Do you support? Would you support Chris Whitty's advice? Reduce the number of households that mix. Try and avoid, essentially, social mixing if you can over the next period.
Yes, I mean, what Chris Whitty said, and, he is the nation's public health doctor, and he's giving excellent public health advice, is that, reduce your contacts to those that really matter to you. So, the less the better. But, I mean, this is the second Christmas that has the potential to be significantly ruined for a number of people. And so, there are also the health issues of not being able to see your loved ones. But so, the answer is to be prudent and, only have the social contacts which are really important to you.
You've had the task of trying to evaluate significant amounts of scientific data for government and advise ministers and so on. That is proving crucial right now. There is a major issue about the modelling that is emerging from various sources. I put to the Health Secretary this morning what the chair of the modelling committee of SAGE said, which is that we are generally asked to model. We are generally modelling what we are asked to model. In a sense, what he's saying is that there is the evidence that is being produced is that which the politicians are asking in order to support further restrictions. Does that make sense to you, that actually what's happening here?
It doesn't make any sense at all, actually. The modelers, the first thing to do is to say that the modelers produce projections, they don't produce predictions. And all of the models have wide uncertainties attached to them as well. And this has been no different throughout this pandemic at all. What the modelers are being asked to do is to model what happens under various conditions of, free mixing, less mixing, to provide the policymakers with the best possible evidence they can have. And there's no suggestion that, the evidence is there to support policy. The evidence is there to help policymakers decide. And that's always been the case. And, one of the big challenges for everyone is that there is inevitably a great deal of uncertainty, particularly during the early phases of a wave of, any pandemic infection, and particularly now where we've got the Omicron variant. It's new. We still don't know a lot about it. So, frankly, the evidence is not there that it is either less severe or more severe than the Delta variant. We just don't know. But what we do know is that the cases are rising very fast. Anyone who just looks at the numbers of cases can see that you can just look at the graph, which is widely available, and you can see that the numbers are going up extremely rapidly. So that's what the modelling is all about.
So, but you do see why this is becoming a political issue, that the critics of the government are essentially saying that the evidence that is being demanded is only evidence that will support the government's desire to impose greater restrictions. And when different scenarios are being offered, as scientists always do, you rightly say they're not predictions, they are different possibilities. That the possibility on which ministers are acting are the worst scenarios. Is that,
but with respect,
a criticism that you can see the sense of?
No, the last thing any government wants to do is to increase the restrictions. I mean, there's no political pressure of any sort, as it were, to increase the restrictions. It's all about actually responding to the evidence from a pandemic where the number of cases are rising fast. We have a new variant. We have pressure on the health service with increased hospital admissions. And the risks are that because of the lag, and that's always the challenge, that people, forget each time that from the moment you get an infection, become symptomatic, to when you may have to go into hospital is a week to 10 days or so. And then it's another, 2 or 3 weeks before the worst effects of the infection, particularly death, may occur. And so, if you're going to act, you actually have to act in advance. And that's one of the difficult things. But, the job of the scientists is to actually provide the evidence for the policymakers. The policymakers are politicians, and therefore, ultimately, the decisions are political decisions. But there's no pressure on SAGE or SAGE advisors or the modelers to do anything other than to provide the best possible evidence, given that there are uncertainties at any moment.
So, Mark, thank you so much for your time this morning. Much appreciated.
Pleasure.
Making sense of the flurry of numbers we're bombarded with about COVID can seem nigh on impossible. Cases are soaring, but how's that going to translate into hospitalizations and deaths? And how will the severity of the new variant influence the level of new restrictions? Well, let's try to work through some of that now with Professor Sir David Spiegelhalter, who is a leading statistician, possibly the leading statistician based at the University of Cambridge and the author of COVID by Numbers. Good morning, Sir David.
Good morning.
Now, we're hearing about a large number, range of possible scenarios for the spread and impact of Omicron. It's pretty confusing, I think, for most people, and it ranges from a widespread but relatively mild disease to a devastating wave that could overwhelm the NHS. Can you just start by with the numbers? Roughly how many cases do you think we have right now?
Okay, the first thing is to distinguish between people who are getting infected and people who then become cases. Because the data we see every day are just the people who have got ill, they've got symptoms, they've gone along, got a PCR test, they've gone onto the system and they've been recorded as a positive case. And those are running, yesterday they went down a bit to 90,000, but we shouldn't take too much notice of those exact numbers. It depends so much on whether people get symptoms, whether they decide to get tested, and labs are going to get very stretched. And so they actually only give a very crude idea of what the infection rate was, about 4 days before. And I think there's no doubt that, we are getting hundreds of thousands of infections every day now, and the majority of them will be Omicron. And I think there's no doubt about that at all. Well, the consequences of that is a bit more tricky. But one thing we can be absolutely sure now about the consequences are purely of becoming a case, because then you're supposed to isolate for 10 days. And that's going to is causing already, and will cause even more, massive disruption. And that's nothing to do with how ill people get and hospitalizations. We just know that there's going to be huge disruption over next weeks and months.
Do you think, first of all, let's do a bit of range finding. Do you think that the likely rate of hospitalizations, given all that, is going to be greater or lesser than with last year's Delta wave?
It could be greater, could be lesser. Now, I know sounds like I'm completely sitting on the fence, and that's because I'm sitting on the fence. Because all the modelling says we don't know. the suggestion is, you had this discussion just now with Mark Walport about the range of scenarios that are explored. Well, one of those scenarios that has been modelled is just to stick with Plan B and not to bring in any new interventions at all. And the models then suggest that hospitalizations would go, pretty confident they're going to go above 3,000 a day. Well, that's still less than it was last winter. So even if we don't do anything more, they could be better than last winter. And if we did do things, bring in other sort of restrictions, then that could be reduced. But enormous uncertainty about those numbers. There's so much we don't know. We are finding out information now from London where hospitalizations are going up. And one of the very interesting things is that if you look at the new cases, the new hospitalizations over and above what there have been over the last few months, around about half of those are actually people who are admitted with something else and then were found to have COVID, probably the Omicron variant. And so that suggests that if you've got a population where a huge number are getting infected, then might go to hospital for something else, but then they found to have COVID, and so they have to be treated as they've got COVID, which of course is a huge drain on resources. So just having a high level of infection itself causes this huge stress on resources, even if people are not getting that ill.
So you're thinking that even if, as people keep saying, the South African data, and I'd be interested in your view about that, is suggesting that it might be milder. Even with that, we could still face, not just because of the numbers, but because of the phenomenon you've just described, an overwhelming pressure on the NHS.
Could do, and it could be, it could be manageable, even with sticking with the situation at the moment. I mean, it very much depends on, there is so much uncertainty. And so what does one do in terms of the action? And I'm certainly not going to suggest any policy whatsoever, is that, just how cautious does one want to be? But as Mark Walport said, one of the crucial things is you can't wait to find out. We can't wait for hospitalizations to go through the roof before we do something about it, because by then it's too late. And in fact, what happens by the end of the new year, by the end of this year, is pretty well built in now. There's almost pretty well nothing we can do about it. And boosters won't have a big effect on it. And we're going to be running, hospitalizations will be up. It's estimated between 1,000 and 2,000 a day. And that is going to happen, whatever we do. So the crucial thing is, when we go further into the new year, what's that peak going to be? Can we delay it? Can we flatten it? And we will know more. We're learning more every day. But in the same case, every day we delay will have a bigger impact further on. Now, I'm glad I'm not having to make those decisions because they are extremely difficult ones. Because
indeed, you say. Forgive me. You say that every day makes a difference. Everybody now, I think, is beginning to understand what the word exponential means, doubling and so on, doubling every day and so on. If you had a free hand, what signal would you be looking for to see that we needed to take stricter, more severe measures, greater restrictions? What signal in the data would you be looking for?
Oh, I think looking at what everyone else looks at. I mean, we would love to know exactly how many people are being infected, and we will find that out, but with rather a delay when we do a proper infection survey, which is going on all the time, but it means there's about a week's delay before we hear about what the results are. We have to just work with the data we've got because we don't see when the virus is transmitted. And we don't see exactly how, why people get particularly ill or whatever. We have to infer it. And that's what stats is about, I suppose, trying to work out what's going on from the little globbits of information that we actually find, which are deeply imperfect. And that I think is inevitable. I think one of the things, the other thing is to actually look outside this country and to see what's happening, for example, in Europe. Holland's just locked down over Christmas, which is something that our government is, of course, extremely reluctant to bring in measures before Christmas. But it's going to be, Austria and Germany, for example, have just managed to control their huge Delta peak it's come down. Their death rates are still, at least double what they are in the UK, and then Omicron's going to hit them. It's going to be very, very tough for these countries. We're not in a great situation, but actually with our vaccine rollout, coverage of boosters is extremely good. It should have been better. We should have done a huge amount more during the autumn, I think, but it's getting better all the time. And so we're actually comparatively in a somewhat better situation than many, many other countries. The other thing is that, sorry.
Professor Spiegelhalter, I think we've run out of time, unfortunately. But thank you very much for joining us this morning.
Thank you.
Well, it's been, by anyone's calculations, a pretty bad few weeks for the Conservative Party. Number 10's reputation is in tatters. Labour's gained a consistent poll lead. There are rumblings about the Prime Minister's future. There have been big backbench rebellions and another crushing by-election defeat. And now, of course, the shock resignation by Brexit Minister Lord Frost. So, just how are the backbenchers feeling about things, and are they limbering up for another big fight with the leadership over COVID restrictions? Let's ask one of those said backbenchers, who is no stranger to rebellion, Peter Bone, MP. Good morning, Sir Peter.
Well, good morning, and thank you for a Merry Christmas to you, and thank you for knighting me. I'm definitely not a knight, and not likely to be. But it's a difficult time, and we have to battle with all these deeply imperfect statistics.
Forgive me. Oh, so there's still a possibility that they could keep you quiet somehow, isn't there? Anyway,
I think that's very unlikely.
Let's deal with the resignation of Lord Frost. He cites concerns about the government's current direction of travel, hopes for lighter regulations, lower tax, and a more entrepreneurial economy. Do you share those concerns? And if you do, is it just you, or how many of your backbench colleagues would say the same thing?
Oh, I think absolutely what Lord Frost says is what I'm looking towards Boris doing in the future, and I think so many of my colleagues are. I mean, Boris has led this country exceptionally well, getting Brexit done, dealing with COVID, keeping our spirits up, getting the vaccination first in the world, saving millions of lives and keeping people in jobs and the economy recovering. But what comes next? And that's what I think Lord Frost was talking about. And I think part of that rebellion of 100 Conservative MPs was partly due to the fact that we want to see the Prime Minister move to a more conservative agenda in the future.
Yeah, but Lord Frost seems to think he's moving in exactly the opposite direction. Here's what he says in his letter. You took a brave decision in July against considerable opposition to open up the country again. Sadly, it did not prove to be irreversible, as I wished and believe you did too. He's basically saying that Boris Johnson was right in July, but he's somehow gone soft. Is that your view too?
Well, I think the argument, obviously, I voted against having vaccine passports, and therefore I do think the Prime Minister was wrong on that, and I'm much more for keeping society open and people using common sense. I mean, I've cancelled all in-person meetings, the get together with staff I've cancelled, and I won't be going to crowded places. But leave that up to the individual to make that decision. Don't have the state telling me what I have to do every day. And so in that regard, yes, I'm with Lord Frost on that. And I think that's it's a job of backbenchers to speak that message to the Prime Minister, so he can take it into account when making decisions. And it really is time for us to. People say you have to live with COVID. We do have to live with COVID. We have to get boosted, and we have to use common sense. But I don't want to have to show a passport to get into a football match, for instance.
Well, Mr. Bone, you say it's all about COVID, but are you sure we aren't still fighting yesterday's battle? There's a WhatsApp group which I think you are of which I think you are a member, and my Sky News colleague Sam Coates, I think, obtained this, in which one of your colleagues, Marcus Fish, says. The whole point of Brexit is radical supply-side reform, moving away from the EU model, yet ministers are happy to give hard-won power in their hands to achieve this to officials who will do the opposite. Are you sure you aren't still fighting 2016 and 19?
I wouldn't believe everything you read from a leaked WhatsApp group. I mean, I look at that WhatsApp.
Are you saying that
think,
isn't
oh,
true?
Goodness,
that Marcus
what's
Fish
being
didn't
said
write
on
that?
Sorry?
Are you saying that Marcus Fish did not write that?
Oh, I don't know, because I'm sorry, I have no knowledge of that. But what I'm saying is I wouldn't rule the country from what's in a WhatsApp group. I think people have got to make up their minds what they want in the future. I want a society that can move forward, more open and not more restricted. And I absolutely agree that we've got great advantages of coming out of the European Union. And one of the things was we wouldn't have had the vaccination program so early if we'd been stuck in Europe in the European Medical Agency. So there are huge advantages, and we must take those advantages and move forward. COVID, I'm afraid, has blown, not unreasonably, the government off course, because it's such a major crisis. And I think Parliament should be back next week discussing. I don't think Parliament should be suspended while there's a national crisis going on. I don't want to eat mince pies and drink tea when there's a crisis. I want to be in Westminster scrutinising the government and helping it make the right decisions.
Not eating mince pies with your colleagues, I'm pretty sure, given the rules. But look, you said that we don't rule things by a WhatsApp group, but the communications between members of Parliament do tell us something about the morale and the spirit within a political party. And here's a striking thing which you might want to comment on. It appears that this same WhatsApp group of Conservative members of Parliament, one of the members was Nadine Dorries MP, who is now the Secretary of State for Culture. And in the discussion on this WhatsApp group, which was basically expressing dissatisfaction with Boris Johnson, she entered the discussion to defend Boris Johnson and was booted off the group. Now, you can say that, all the high-minded things about freedom and all the rest of it, but doesn't this really speak of a party that is pretty much tearing itself apart?
Well, that's definitely not true, the last bit. I think there's a great deal of support for the Prime Minister. I'm a great fan of Boris. I led the Back Boris campaign along with Tom Pursglove and Helen Harrison. I mean, we're right behind her. We just want to say, come on, let's get on to a Conservative agenda. And I think the thing on the WhatsApp group, I might be wrong, but I don't think ministers are supposed to be on that particular WhatsApp group, and maybe that's why Nadine was removed. But to be honest, I don't care tuppence about WhatsApp groups. I really don't.
Look, the underlying point is here that you are expressing an admirable degree of loyalty to the Prime Minister this morning, but the truth is a large number of your colleagues, who knows, maybe half of the backbenchers, have, first of all, more or less fallen out of love with the Prime Minister, and more importantly, possibly, do no longer think of him as the winner that they backed in 2019. Do you still think that Boris Johnson is an asset to the party that it cannot do without?
Well, first of all, let's make it. I absolutely think he's an asset to the party. I disagree fundamentally with your analysis that there are huge numbers of Conservative MPs that are against the Prime Minister. I think what's being mixed up is the rebellion over vaccine passports, which people felt in principle were completely wrong, and the desire to get rid of the Prime Minister. Look, if I wouldn't be defending the Prime Minister if I didn't think he was doing a good job. I was quite happy to stand up in the House of Commons and call for Theresa May to go in the middle of the Brexit Brexit crisis. So no, I absolutely don't think that's right. I think the media are misinterpreting that.
If they bring in, if they ask you to agree to vaccine passports, what's the number that will rebel?
Sorry, did you say vaccine passports? Well, we've always voted for that.
Correct. More restrictions. Let's just more restrictions.
Yeah, more restrictions. So look, say the government came along and said we need to go into full lockdown, and what they have to do is come to Parliament, make their case, make the arguments, explain why.
But how many are going to rebel?
Well, no, you can't. You can't answer that question until you know what the situation is, and that's the point. Come to Parliament, make your case, be scrutinised, debate it, and then we'll decide. And if necessary, if I think they're right, I'll vote for it. If I don't think they're right, I'll vote against it.
Mr. Bone, thank you very much indeed this morning. England's chief medical officer, Professor Chris Whitty, created headlines and no shortage of anger this week when he told people to prioritise and limit social contact ahead of Christmas. Since then, pubs, restaurants, theatres and high streets have been eerily quieter than they would normally be at this time of year. It's had a huge impact on business, especially entertainment, travel and hospitality. Few people know their way around a restaurant better than the world-famous chef Michel Roux. And I, to my great pleasure, can speak to him now. Good morning, Mr. Roux.
Yeah, good morning, Trevor. You can call me chef.
Good morning. Absolutely. You absolutely on the money. Good morning, chef. Look, your family's been running restaurants for generations. How bad is it now?
It's really dreadful. It's terrible. I mean, on a very serious note, this is as bad as March in 2020, the first lockdown. The biggest issue for me is the lack of communication from the government. There are no, well, we're being told one thing, the public is being told one thing, so don't go out, don't go to Christmas parties and don't congregate in numbers, which in turn means that people aren't going out or are cancelling Christmas parties, cancelling events, and being very careful. Now, it could be quite rightly so because of this pandemic, which is awful and it is real. But it means that what should be our most prosperous month as restaurateurs and as hoteliers and as publicans is now turning into a loss because people are not turning up. So I'm all right with locking down. Don't get me wrong. Locking down is a good thing if it's going to save lives and it means that the NHS is not going to be put under pressure. I mean, Lord knows that the NHS is doing an unbelievable job, fantastic job, and praise to them. And of course, let's not forget all the volunteers, because also the rollout of the booster and of the jabs in the first time round, it's not thanks to the government, it's thanks to the NHS and thanks to the volunteers. So what we need in our industry, and not just our industry, is clear government, proper government with a pair of cojones that takes decisions on time, not waffle.
What would you like to hear from the Prime Minister over the next couple of weeks?
Clear decisions. It really is simple as that, Trevor. I mean, we don't know whether we're coming or going in our industry. We are losing business. We are losing livelihoods. And also very, very important point, because we're talking about hospitality industry here, which employs 2.5, 3 million people directly. What about the ecosystem around the hospitality industry? So all the drivers that come and deliver our goods, all the security, the cleaners, the collection of refuse, the suppliers, the supply chain is immense. I've had suppliers on the phone in tears asking me to take some produce, but I can't take produce. I've had a collapse of bookings and I don't know whether I'm going to be open tomorrow, let alone next week. So, we need clear decisions. And if we get locked down, then we need compensation. We need financial help. And again, I reiterate, not just the hospitality industry, but across the board. We need proper, firm government and a government that we can respect.
Give us a picture of what this level of uncertainty means in your business for, one of your restaurants or one of your family's restaurants.
Yes, I mean, I tweeted recently last week about my daughter's restaurant, and this is a new business, a new restaurant with a big debt, and that's another thing. A lot of restaurants, small businesses, are already laden with debt, and we're getting help. Yeah, we have to take a loan out, and that's another debt. That's adding debt on debt. So that I don't consider that help, financial help. But anyway, that's another story. So she was building up to a prosperous December, a December that would see her through the lean months of dry January and February and March. They're normally quiet months. So in this industry, we need to build up reserves in November and December to see us through. Well, that's gone. That's finished. Nothing left. So she is now into a loss situation business-wise in December.
The Chancellor's just come back from California. Industry leaders are saying that some businesses are going to sink. They're going to go under. What practical help would work for you? What would you like to hear Rishi Sunak announce once he's done his sums?
Well, first of all, we need assurance going forward. So next year, the VAT is likely to go back up to 20%. Well, it would help immensely if it was either kept at 12.5 or taken back down to 5. Business rates need sorting out. It's the most unfair system ever. And then statutory sick pay is one that I would like to see reformed as well, because at the moment, people who are catching COVID with very mild symptoms are thinking, well, shall I go to work or shall I just take statutory sick pay? You can't survive on that. You can't pay the rent. You can't. There's no way. So and then the burden is put back on the employer. That's not right. So there are a number of things. But if we are going to go into lockdown, and as I said, I'm not against lockdown. I'm really not, if it's for the right reason. But we need to know. We can't have this dilly-dallying around and this waffle that's coming out of the government at the moment.
You are, of course, proudly British, Michel Roux. We claim you 100% as our own, but of course you have some French heritage. What do you think about the French decision to essentially ban travel between here and there?
Well, it's a firm decision. I mean, the one thing, whether you like or dislike Macron, he takes decisions, and that's another thing. I think there's a lot of politicking going on between Macron and Boris Johnson. One thinking he's Napoleon Bonaparte, and the other one thinking he's Winston Churchill. Come on, guys, get out of the playground and behave properly. But at least. Decisions are made, and they are made quickly and with direction. It was the same with the lockdown back in 2020. Macron took this decision to close the restaurants early, or close down the whole country early, and to police it properly, firmly, and to put a proper package to help the hospitality industry. And that, I think that's all we want. And it's not just the hospitality industry, it's what everybody wants, is clear decision making.
It is a politics programme, so I'm tempted to ask you about goose versus turkey also, but I have to ask you a proper question. It looks like there might be another lockdown. Do you think that the industry can survive another one?
If there's adequate compensation, then yes, there will still be some casualties. And another thing which I've not spoken about is mental health. It really is incredibly tough. I mean, 2 days ago, I had team members, staff members at my restaurant asking me, "Are we shutting? Are we not shutting?" And the consequences of that, and tears in their eyes, welling up. I mean, really not knowing whether they've got a job or not. And we're trying to entice people back into the hospitality industry. So, how is this going to work? It is incredibly difficult times. So, It's not just, not just one thing. It's very, very difficult. But we need, as I said before, and I keep on saying, it is a strong government that will take decisions and give us proper help.
Michel Roux, it's been a pleasure talking to you. Thank you so much.
Thank you.
There are, of course, just 6 days until Christmas, and whether you are a person of faith or not, a time for spending time with family and friends. For the second year in a row, that will not be possible for many of us, and this time of year is once again filled with uncertainty, as Michel Roux has just been saying, concern for many, and hardship. So, with fewer of us turning to the established church than we used to, what does it have to offer a United Kingdom struggling with the impact of COVID? Live to Thanet, where I can speak to the Bishop of Dover, Rose Hudson-Wilkin. Good morning, Bishop. Thank you for joining us. I know it's one of the busiest working days of the year for you.
Good morning, and I'm in Thanet because I'm just about ready to do a confirmation service.
Well, look, what impact is COVID having on worship and worshippers this year?
The church has also borne the brunt of the impact of COVID in terms of, we had the church locked, and then people have started coming back, but there is social distancing, and some people are still shielding, and it has impacted on the church financially in the same way that it has impacted on business and ordinary people's lives. But, we are God's church. This belongs to God. And so we are there to be a sign of hope for the community and the world around us.
Is that sign of hope going to be open to worshippers through Christmas and New Year?
I believe that we will be open through Christmas and going into the new year. We have learned what to do and how to manage in this pandemic time. We have learned how to make sure that we keep safe within our churches, something that we didn't know initially, but we do know that now, and we will continue to make sure that we are safe once we're in our buildings.
If the government were to say, we're not going to legislate, but we really would prefer people not to gather, what advice will you give to the priests in your diocese about, for example, Christmas morning or Christmas Eve services, Christmas morning, and indeed what in the old days we used to call watch night services at the end of the year?
Because, as I said, we now know how to keep ourselves safe in terms of washing. We're going to have to live with coronavirus. It's not going to disappear. And so we can't just lock ourselves away. But what we can do is that we can stay safe. We wear our mask, we clean our hands regularly, we keep social distances, we don't gather unless we have to. So I would want the clergy in my diocese to make the kind of decisions that says we are keeping you safe when you come through these doors. I trust my clergy, and I am sure they will make the right decision.
This is a politics show, so of course I've got to ask you something on that, though of course not partisan. You've probably seen more of politics than any cleric of any denomination, having been chaplain to the House of Commons. Getting us through the pandemic does depend on the authority of our leaders. Do you have any fear that the scandals and the revelations of the past year have damaged if you like, the moral authority of politicians?
I think without a doubt, we have to say that the mixed messages and the do what I say and not as I do will undoubtedly have an impact on the nation going forward in terms of how we respond. And so I would want to encourage our politicians, our political leaders, to actually ensure that the messages that they're giving to the wider community is a clear message, and also that they follow the message themselves, and you know, that they say this is for all of us and not just for you and not ourselves. We do our own thing.
In a way, you're echoing the Archbishop of Canterbury's message the other day, which is an appeal for honesty in politics.
Yes, well, you know, it's not just honesty in politics, it's honesty in our lives, the need for us to live lives that is credible for all to see. So, you know, let's not beat the politicians alone. It's for all of us to adhere to.
Bishop, I wouldn't do anything so vulgar as to ask you to summarise your upcoming sermon, and of course some of our
I would love to.
Some of our viewers won't share our faith, but in 30 seconds or so, it's been a tough year. What is the shepherd's message to the flock?
I think the main message that I want to share is that God loved, for God so loved the world, and it is from that love that God gave. So what we have is this generous God who gives of himself to the world in his Son, Jesus Christ, who came to dwell with us. So that's my message. Let's practice that love.
Thank you, Bishop.
Thank you.
That is as much as we have time for this programme, and indeed for this year. We'll be back in the new year, but till then, I guess the goose is getting fat, but maybe a bit nervous about whether they're going to be needed or not. Enjoy your holiday.